Hi students, welcome to this video. We are discussing oral pathology here. Okay, so in this video we will discuss a topic. This is infectious disease of oral cavity. Infectious disease of oral cavity include your bacterial, fungal, and viral infections. So it is actually a pretty big chapter. That is consisting of all the bacterial infection, viral and fungal infection. But do we have to learn the whole thing for your NEET preparation? Actually, what for a basic amount of preparation, you don't need to go into much detail. There are certain infectious diseases that is important and they are questioned from that area. So we will discuss in this video, we will discuss what are the important infectious diseases you should learn and what are the question areas in this. Okay, so this is just a summarizing video for you, so that you don't feel that much burden in the subject. Okay, so let's start with the certain bacterial infections. So bacterial infections, mainly there are many bacterial infections affecting the oral cavity. First, I will start with the scarlet fever. Okay, now scarlet fever, scarlet fever is caused by your beta hemolytic streptococci. Hemolytic streptococci, right? So this scarlet fever that affects usually the children, actually young individual. Okay, you can see beta hemolytic streptococci infection, and they have what the manifestation is. They manifestation as redness. Okay, they manifest as erythemas. Okay, erythemas or skin rash. Skin rash is what you see. This rash is due to the exotoxins of this beta hemolytic streptococci. Okay, that exotoxins, they will attack your skin, they will attack the tonsils, this tonsillitis, pharyngitis. Okay, and along with that you will have this skin rashes. That's why we see skin rashes in your scarlet fever. Okay, and this skin rashes near the skin fold, they are called pastia lines. Okay, pastia lines. Okay, all these are certain features, and the skin rashes will be very rough. Okay, these skin rashes will be very rough, and that will feel that when you touch that area you feel a sandpaper like skin. Okay, sandpaper like skin. Okay, so this is of about your scarlet fever. But in the oral cavity you can see a manifestation. Now that is little important. The oral manifestation of your scarlet fever is that the tongue, it is manifested mainly in the tongue. In the tongue you can see that your papillae, mainly your fungiform papillae, will be what, hyperemic, or it will be edematous. Okay, edematous. So what you see is that on the tongue you can see that this fungiform papillae will stand very prominent. Okay, they will be very prominent fungiform papillae, and that type of tongue, or that presentation is called a strawberry tongue. Okay, strawberry tongue. As the time goes on, the tongue will lose a white color. It is gone and the tongue will become more purplish. That time it is called a raspberry tongue. So in the initial stages it is strawberry tongue, where you have your tongue has white color and whitish background, and in that whitish background you get this fungiform papillae edematous, and that is called the strawberry tongue. And later it is called when the whiteness is lost, and what happens is that you will see a raspberry tongue. Now let's see the next bacterial infection, that is your TB. TB, it is tuberculosis, and it is usually it is caused by your mycobacterium. Okay, tuberculosis, mycobacterium tuberculosis. And TB is usually an airborne disease, and it affects first primarily. So there is two types of TB, that is your primary TB and your secondary TB. A primary TB that affects mainly and for the first time, where you have no previous infection, that is the first infection, and that is mainly affecting your lungs. Okay, because it is an airborne disease, it primarily affects your lungs. And secondary TB can affect after a reinfection. After a reinfection, means you already got a primary TB, the primary TB may get reactivated or reinfected, so then you get a secondary TB. Okay, so nothing much. But what you see in the TB, okay, what you see in the TB, what is the oral manifestation of TB? Mainly, what is the oral manifestation? Okay, the oral manifestation of TB is you can see ulcers. Okay, you can see TB ulcers. TB ulcers. Where these TB ulcers are usually seen? TB ulcers are usually seen on your tongue. Okay, you have a punched out, irregular, punched out ulcer on the tongue. That is a peculiarity of this TB ulcer. And mainly TB ulcers are seen on the tongue, and they are called. They have another name called stellate ulcers. Stellate ulcers. The TB affecting your bone is called a TB osteomyelitis. Okay, so these are certain features about your TB, and you don't require much in detail about this. When you are discussing, I think you are seeing it in your micro also. Now let's see another topic. It is your syphilis. Okay. The third one, bacterial infection, that is your syphilis. Now, what is there in syphilis? What to see in syphilis? Syphilis is caused by your Treponema pallidum. Treponema pallidum, that is a bacteria, that is a spirochete. Actually, it's a spirochete. Spirochetes are your spiral bacteria. Okay, they have this shape of a spiral. Okay, spiral bacteria. Now, what is there in syphilis? Syphilis is a sexually transmitted disease, or it can get from mother to child. Okay, so there is sexual transmission. Syphilis is a sexually transmitted one, means during unprotected sexual transmission. Okay, second one, it is congenital. There is congenital syphilis also. Now, congenital syphilis means a mother, if she is infected by syphilistic bacteria or the Treponema pallidum during her pregnancy, where she is carrying the child may get syphilis, and that condition is called congenital syphilis. Now, let's see what are the features you see in syphilis. Syphilis has 3 stages. So many questions they ask from the stages of syphilis. The first stage is called a primary stage. Okay, second stage is called a secondary stage, and third stage is called a tertiary stage. Now, we can easily learn what is there in the primary, secondary, and tertiary stage. The primary stage, the lesion will appear on the oral cavity or in the genital region. Okay, so syphilis is actually a sexually transmitted disease. The primary lesion is called a chancre. Chancre is a painless ulcer. I am writing painless ulcer. This painless ulcer is seen in the site of inoculation. We say it is seen at the site of inoculation. Site of inoculation for a sexually transmitted disease, site of inoculation is your genital organs. So due to oral sex practices, it can come in the oral cavity also. Okay, that is chancre. The chancre is mainly a painless ulcer. It is mainly seen in the lip, can seen in the genital regions. Okay, genital region, and in your oral cavity also, it can be seen on the lip. Okay, mainly can be seen. The secondary stage, in the secondary stage of syphilis, means after the primary stage means nearly 3 weeks to 3 months is the primary stage. From 3 months to 6 months, we can say that it is going to secondary syphilis. In secondary syphilis, you can see that there is a condition called a redness or patches on the body, that is called mucus patches. Mucus patches. So this these are patches or redness or eruption seen on the skin. So now the syphilis, which is seen on the skin, the symptoms are seen on the skin, and this condition is very contagious. Okay, very contagious. This can what cause a transmission. Okay, so mucus patches. What other lesions you see in secondary syphilis? Just remember the names. Okay, condyloma lata. Condyloma lata. You can see snail track ulcers. Snail tract ulcers, condyloma lata, mucus patches. Okay, so all these are certain names of the lesions which you see in the secondary syphilis. Now, secondary syphilis is very what contagious. Now, coming to tertiary syphilis, the patient is not treating after 6 to 9 months. You can see that the patient will go for a tertiary stage. In the tertiary stage, what happens is that this will affect your central nervous system. Okay, it can go affecting your central nervous system, it can affect your cardiovascular system, your internal organs are affected here. Okay, and you can say that there is multiple granulomas here. These multiple granulomas are called gammas. Multiple granulomas are called gammas. And on the oral cavity, you can see a feature called there is palatal perforation. Palatal perforation means there will be holes in the palate. Okay, palatal perforation there is can be seen in tertiary syphilis. Okay, so these are certain features you see in the tertiary syphilis. And if I have the images, no, I don't. I think it's not there. Okay, so let's see what is there in the congenital syphilis. There's one condition called congenital syphilis. I think I have the images. I will show you the images of your um, bacterial infection, infectious diseases. Okay, yeah, you can see this. I think I hope you can see this picture. The first picture is your chancre, right? First picture, what you are seeing is the chancre, and in the second picture you are seeing the mucus patches. That patches is there, and third picture you can see the palatal perforation. Okay, and you can see the granuloma formation. This is called a gamma. Okay, this is called a gamma, and you can see the palate is perforated. Okay, palate is perforated. This is called a palatal perforation. This is tertiary syphilis. Okay, this is tertiary. Okay, and here comes the other one, that is congenital syphilis. There's only two things you should remember in congenital syphilis is that congenital syphilis is caused due to mother to child transmission, and in congenital syphilis you see a particular type of incisors and the molars. Okay, this particular type of incisor is called a screwdriver shaped incisor. Okay, screwdriver shaped incisor, and this is called a mulberry molars. Mulberry molars. Yes, it's just looking like a mulberry. There's multiple lobules of your enamel is there. Okay, this is congenital syphilis. Okay, so this is all about your syphilis. We have seen syphilis, congenital syphilis. This is strawberry tongue and the raspberry tongue of scarlet fever. So you can see in this first picture, you can see strawberry tongue. Okay, you can see that there is edematous. Your fungiform papillae, your fungiform papillae is edematous here, and that whiteness is lost. When the whiteness is lost, it is called a raspberry tongue. So okay, second picture. This is called this calls the raspberry tongue. This is a strawberry tongue. Okay, and this is syphilis and. Okay, that's all for your bacterial infection. Okay. Now let's see other infectious diseases in the next part. Okay, thank you.